And a very warm welcome to you. It's my pleasure to welcome you to another edition of Editors Forum. I am Rita OMODIA, and of course on this program we get to discuss topical issues, front burners, headline stories that made headlines during the week. I am Rita OMODIA, and I hope your week has been a splendid one indeed. And of course, one of the major issues affecting Nigeria and globally is the COVID-19 pandemic. And so far, so good. From reports that we have, Nigeria has recorded 245 new cases of coronavirus, bringing the total number of infections in the country to 7,261. The Nigeria Center for Disease Control made this known on Friday. It added that 10 more patients died of coronavirus-related complications in the country. Now, it also said that out of the 245 cases, Lagos once again is topping the chart as it recorded 131. Jigawa State had 16, Ogun State had 13, Borno State 12, Kaduna 9, Oyo State 9, Rivers 9, Ebonyi 9 cases, Kano has 8 cases, Kwara has 7 cases, Katsina 5, Akwa Ibom 3 cases, Sokoto State 3, Bauchi 2 cases, Yobe State recorded 2 cases, Anambra 1, Gombe 1, Niger 1, Ondo 1 case, Plateau 1 case, FCT 1 case, and Bayelsa State 1 case. Of course, statistics suggest that no fewer than 5,033 active COVID-19 cases are currently in Nigeria. Meanwhile, across Africa, a total of 100,002 cases had been registered as of Friday, of which 3,105 were fatal. Globally, we have that the reported coronavirus cases top 5 million worldwide, and of course we know that this is a really devastating effect on the economy, on Nigeria's economy, and globally. Well, on today's edition of the show, I will not be alone. I have with me Tony Nwaje. Very much thank you for joining us on the show.
Thank you so much, Rita. I'm good in Nigeria.
And how have you been doing so far?
Oh, thank God.
You're managing with the whole COVID-19 crisis.
We don't have a
You're
choice.
Surviving.
Yeah, we're praying to get to the sun.
All right. Okay, first time with me on the show, I have Ayodele Lawaladio. Thank you very much for joining us on the show. He's the chief editor of the Avalon Daily. Thank you very much for joining us on the show.
Thank you for having me.
And how have you been doing so far?
Surviving.
Surviving, that's the key word there. Of course, the key word is to stay alive. Make sure you follow all the safety precautions that have been given to you by the Nigeria Center for Disease Control, that is the NCDC, the WHO. Of course, we've been reiterating it over and over again. Make use of good personal hygiene, wash your hands regularly, and if you're not with soap and water, make sure you use alcohol-based hand sanitizers, keep social distancing, and if you're in crowded places, please make use of your face mask. Of course, we do know that as a result of the coronavirus, there has been lockdown, and following that, we had the lockdown ease, which of course brought about curfew in most parts, that's in Lagos, Ogun State, and in the SCT. Now, of course, also with the COVID-19 pandemic, we know that schools have been shut down, churches, religious gatherings, social gatherings have been closed, and of course, even if you're in a place, it should be not more than 20 people in a specific place to avoid the spread of COVID-19. All these are the safety precautions to ensure that the disease does not spread as much as it is going, even though we know that the number of deaths, it's really increasing. Well, we'll start with school issues now. Let's not forget, as I said earlier on, schools have been closed down. And so President Muhammadu Buhari's pronouncement during his broadcast to the nation on March 29th, the day he ordered the lockdown of the Federal Capital Territory, Abuja, Lagos, and Ogun States, as part of measures to contain the spread of coronavirus, said and instructed the Ministry of Humanitarian Affairs, Disaster Management and Social Development to work with state governments in developing a strategy on how to sustain the school feeding program during this period without compromising social distancing policies. Now, he said, to cushion the effect of the lockdown, the president announced some policies which included the sustenance of the school feeding program, even though the schools remain closed, immediate payment of the conditional cash transfers for the next 2 months to the beneficiaries, deployment of relief materials to residents of satellite and commuter towns and communities around Lagos and Abuja, and a 3-month moratorium to loans to all trader money, market money, and family money beneficiaries. All these is to cushion the effect of COVID-19 on the economy, as most Nigerians complain of hunger. So the federal government reinstated the lockdown school feeding program, which would allow for school children to be fed during the COVID-19 pandemic. But there have been lots of reactions to this. I know in Lagos State it started in Abuja. We also had a series of this school feeding program, but lots of people are still complaining that this act is fraudulent and there should be no school feeding program while there's a lockdown, especially with the area of logistics. So Tony Nwaji, I'll start with you with this topic here, the school feeding program logistics. Do you see it in good faith, or do you see that we might have problems in the sharing of palliatives?
School feeding program. Let me put it this way. It's a laudable program from the federal government. It's something we need to encourage.
Okay.
But school feeding program at this point, I have issues with it, and I've not stopped pinpointing areas I think government needs to really sit up. The country is not a comedy space. We're battling COVID-19, and then suddenly we're talking about a school feeding program when the kids are at home. And most times I sit down, I listen to the Minister of Humanitarian Affairs. I want to, okay, maybe I need to be educated. Maybe I'm not getting certain things right. But this time I listen to her, I come out more confused, because it appears she doesn't even know what she's doing about it. There are no statistics. 2 weeks ago, I watched an interview where questions were put to her on how the modalities, the register they are using, and calls were coming in from communities, and she couldn't give any response that makes sense. Somebody was calling and saying that they don't have register in their community. How are they going to, for instance? Because so far it's only in FCT and Kano. And I learned they are coming to Lagos, I think 2 days ago, that's on Thursday. I'm yet to see, I've searched, I'm yet to see, the minister is not in Lagos yet to do that. So, and we have 36 states. She has not been able to she has not been able to tell us exactly how she's going to go about it. I don't see anything wrong in, before you take such a step, sitting down, calling people who matters, who understand this thing better than you. That's okay, we're going to go around the state. We're going to go around the state of the federation. We are not talking about Abuja. We are not talking about Lagos. We are not talking about only Kano. We are going around the states of the federation. How do we reach out to students? I didn't hear that. And somebody asked, okay, how much has the government so far disbursed? She couldn't give an accurate figure. She was saying it's running into millions. So on that, I don't want to look. I'm trying not to sound critical of government on this. As I said earlier, it's a laudable program, but for me, I would have expected the government to wait for schools, for children to come back to school before they kick-started. This is the same country where it was difficult for them to even reach out to students while they were in session. They are not in session now, and I don't understand the rush. Why you want to do that at this point in time? We are battling COVID-19, and you're saying you want to. How are you going to do that? Okay, last week, the one on FCT, I sat down and I followed the story, and I saw what they distributed to parents, and I'm wondering. So they actually gathered some people in a square, and they gave them some bags of rice, beans, palm oil, and some food seasoning and all that. And they said it's going to last for a month. The egg, I think I counted about 12, half crate of egg lasts for a month, a family of 4. And I'm wondering, we joke a lot in Nigeria. We joke a lot, and that is what I'm not happy about. We don't take things serious. If I have the opportunity to be with the minister at this point, I would just tell her straight up, can you just put a stop to this? This Nigerians need this. We need, and at the end of the day, can you actually give account of what we spent so far? We don't need this at this point. Can we just wait after battling COVID? That's not what Nigerians want now. And for me, it's simple distraction. What Nigerians want at this point is that palliative. The lockdown, that first 2 weeks, there was this so much.
But it was due to the need for the palliatives that they're actually venturing into the school feeding program.
Yes.
Because that's what Nigerians are clamoring for.
School feeding program for the students. How do they reach out? I mean, I want to know how you reach. Okay, the students are in the house, they're in their homes, they were not in school. What I'm trying to say here, when the schools were in session, it was difficult even going around schools to feed them. Now they are at home. What register are you using? What names are you using in reaching out to students who are now in their houses? You couldn't reach out to them in schools. How can we then reach out to them? And we know in this country we don't have data. So how are you achieving this?
Okay, all right, thank you very much, Tony. You've pointed out the problem of logistics and data, non-accountability for this palliatives. Adio, what's your own take on this?
First, I think it's a nomenclature problem. It shouldn't have been termed a school feeding program in the first place. I think it simply should have been termed, some palliative for low-income families. Because if you looked at the first beneficiaries of the program, you didn't see kids queuing up. You saw parents, men and women who queued to get this food items home. So I think it's a nomenclature problem. It's not a school feeding program. I think it was designed to help low-income families, and it should be branded as such. So there's a wrong communication even from the conception of the program. And of course, that's why it's raised a lot of red flags, because there's absolutely no way that you can monitor the feeding of children from your ministry in Abuja, in Katangura, in Zungeru, and in other places in the country, right from Abuja. It would be totally impossible to do that. But if you had branded it a low-income palliative program for low-income families who have lost their livelihoods, who have been unable to go to farmlands, who have been able to trade, who have been able to earn an income, then we can have a conversation as
to. But don't you think that would be like a replication with the other palliatives you're given?
Again, that's the problem. There's a lack of coordination here. There's too much. There's a lack of coordination, a lack of coherence. Their communications are completely all over the place. And I think the greatest problem here is the fact that there's a lack of a plan. That there's no exit strategy from this COVID-19 lockdown or interstate travel and all of that. You see, countries are releasing a blueprint and a plan as to how they want to engage going forward after they open up their economy, how they were going to deal with welfare vis-a-vis the opening of the economy and to drive productivity. In our own instance, there is absolutely no plan. It is just, it's as if we're hoping against hope. So maybe after 2 weeks we'll reopen the economy and everybody go out as business as usual. And that exactly is where my problem lies, because if you're a business organization, if you're in a business entity, you cannot plan your next 3 months, because there's no plan from the federal government, there's no plan for the states. People do not know when things are going to open up fully, or how things are going to open up, or how things are going to work out in the next 3 months. And once that is not clear, it makes it difficult not just for the business community, it makes it difficult for investors, it makes it difficult for planning across broad. So for me, it has to start with a carefully coordinated plan from the federal government, coordinated carefully with the state governments, because it is almost impossible to run a palliative program from Abuja across 36 states. So you have to coordinate excellently with the 36 states. You have to coordinate with the 734 local government. Everybody needs to be singing from the same hymn book. The goals have to be clear. The objective have to be clear. And then we can make progress. But at the moment, everybody's just all over the place. Nobody knows where the next step is going to come from. Today, it's a school feeding program, whereas his parents coming to queue to take up food. Tomorrow, the NNPC is saying they are putting ₦1 billion to feed people who are stranded coming in from abroad. For goodness sake, we have better things to do with our money. The NNPC is not a caterer. It's not in the hospitality business. Why are you cooking food and housing people who are traveled abroad? We need better use for our money. And that $1 billion could have gone into the healthcare sector to create better the values. So I think we really need to have a clear plan as to how we want to move forward during this pandemic, as to how we want to rejig our health systems, to strengthen it, to be more resilient in case there is a rebound of this infection, and how we want to reflate the economy going forward. At the moment, it's hazy.
All right, thank you very much. While there's still criticisms concerning the school feeding program, some people still talking about education and schooling. Some private school owners in the country, under the ages of the National Association of Proprietors of Private Schools, have called on the federal government to embark on a gradual reopening of schools in the country, beginning with students in terminal classes such as primary 6, junior secondary school classes 3, and senior secondary school class. Tell me, Waji, do you see any possibility with that, or let's just wait till we've overcome this pandemic?
I think we should wait. I understand the plight of my school owners. They're facing difficult times. School fees are not coming in anymore, and they need to pay teachers. It's a tough time for them. I understand, but I think life first. Can we just wait? I can, from what I'm seeing, maybe in the next couple of weeks, schools might go back. And right now, they're even doing online stuff, like online teaching, lesson and all that. And parents are paying. So they're not lacking in all, at least they're getting, but it's not what they expected. So they should just stay. I mean, I know a school in the island that's taking about 175,000 for a lesson. Some here in mainland are taking 100K and all that. So in the interim, can we just hold on a while? It's not about going, before you even go back to school, a lot of certain things need to, because life has changed. A lot of things will definitely change after this crisis, after this, I call it crisis. School won't be the same anymore. There must be this social distance. You can see what's going on in the banks. People troop out every day, and you see them surging in and all that. But I'm happy the bank has been able to, come rescue that situation. It's likewise going to happen in school. So it's not about opening school. What are the schools doing at this moment? What are you putting in place? Because it's not going to be like people coming and going and all that. There must be social distancing. Do you have the hand sanitizers? Are you going to, are you going to make sure that this, because it's not that by tomorrow this thing ends, the pandemic ends. It's going to take a long time. So if school resumes tomorrow, what are the measures you are going to put in place for the new normal, in the interim? That's the question the school, that's the answer I expect the school to answer, the question I expect the school to answer. Then government is considering. Schools can open now, it will be suicidal. Because the way we take things, we don't take things too serious. I've listened to a lot of people, and I think we think it's a joke. We can't open the school yet. We can't open maybe in the next 1 month or there, maybe 3 weeks time, or 4 weeks, so that the school itself can come together. It's not even. I think government has to come in here, because if we allow the school to do their way, definitely they are looking at something, and that's the school fees. Put them in place. These are the conditions you must meet before our children can go back to school, both public and private schools, and even tertiary institutions too. Okay,
Chenawaji has talked about the fact that before schools can reopen, there have to be logistics in place. But let's look at the effect of this pandemic on education, Adio, in general, post-COVID-19. How do you see education in Nigeria going?
I think, first of all, it's highlighted the inequality in our system. So you have people in private schools who are having lessons at home because they can afford to own a computer, they can connect to the internet, they can download lessons, and parents can engage their kids at home. Unfortunately, the low-income earners around the country who cannot afford the computer, who do not have access to internet, have just been redundant. They cannot learn. They are wasting valuable time. They can't cover, reasonable ground, and unfortunately, they will all write the same exams. So you see that the elites are already 2 steps ahead of the people who we have left behind in our society. So if there's one thing that the COVID-19 has highlighted, there's the huge inequality gap in our country, wherein the haves have been able to mitigate the challenges of COVID-19 by all sorts of lessons that they can download online for their kids and engage with their teachers, even in private schools. But the people in public schools, who make up the majority, have been completely shut down. They do not have the access to internet connections. Their parents cannot afford,
or even light.
Thank you very much. They don't have power. Their parents cannot afford to buy a computer for each child at home so that he can take his own lessons individually. So it's sad, it's a shame that there's been a lack of investment in public education over so many years, unfortunately from leaders who benefited from public education in our country. So I think it's highlighted the inequality gap, and it's highlighted the need to invest in public education. So I think for me, what I want to see going forward after this pandemic is a coordinated effort from teachers union, from public schools across the country to demand more from the government, to demand better investments in public schools, to demand better infrastructure in public schools, to ensure that the kids in public schools also have access to the internet, have access to computers, and can also compete with their mates in private institutions. Because like I said earlier on, they will all write the same exams. They're going to write the same WAEC, they're going to write the same common entrance examination. So what happens when schools reopen and they're telling them they have 2 months to rush through the curriculum? People in private schools are already 3, 4, 5 months ahead. The guys in public schools are playing catch up. And then at the end of the day, they pass, the people in public school fail, and then the equality gap continues to widen. So I think looking forward is to really ask the very hard question on how we can improve public education, how to improve spending, how to improve quality, how to improve training, so that at least the people in public schools can have a chance. We need to give them an opportunity to succeed in what is gradually becoming a difficult global economy. And if they are not properly educated, if they are badly educated, and we deny them certain opportunities and capacity development, they will completely be useless in a 21st century economy that is going digital and is going to be driven by technology. And we cannot afford close to 70% of our citizens completely wasted. So for me, going forward is to rethink investments in public education, and to pressure government to do that, because it's his responsibility to educate his citizens and not the job of private institutions and religious organizations. He has to do his job. So he must invest in public education, and he must do that as soon as possible.
But you know why they can't invest in public education?
Why?
Because they killed it. Almost everybody in government owns those private schools. We're talking about, we started with primary schools, nursery, secondary, now they've gone to tertiary level. They own these institutions. So because they own these private schools, private universities, they don't care about the public anymore. No matter the cry from now till tomorrow, they are not bothered. They will watch public institutions, public schools go down the drain. They are not interested. So what the private, they're in control. They're in control of the private schools, and they cannot legislate any law that seems to likely benefit the public institution. It's not today. People have talked about this over time. It's not working. So what private institutions seems to have, you can imagine a secondary school taking 2 million naira a session. So I went to university, I didn't spend up to $1 million. I don't think I spent up to 500,000. But that's what the secondary schools are doing today. And where's government here? Who's regulating these fees? They don't care, because they participate and they are benefiting bountifully from this. It's not going to work. Maybe tomorrow, but for now, no way.
Okay, while we've still highlighted some of the problems there concerning the school feeding program, of course, lapses in the education sector, we also look at the fact that back here in Lagos, amid the rising number of cases and the refusal of persons who test positive for COVID-19 to go to isolation centers, many states have said they will continue to treat the infected patients at isolation centers rather than resort to home treatment option. They noted that getting persons who had tested positive for the virus to the isolation centers remained one of the strategies to contain the spread of the deadly virus. But back here in Lagos, the Commissioner for Health, Akin Abayomi, said on Thursday that the state is in the process of regularizing home isolation and treatment for positive COVID-19 patients in the state. In other words, you have the option now of not only going to isolation centers but isolating yourself at home. Now, do you see dangers with this particular option that people treated? How many people can treat themselves at home? They've not necessarily put any measures, or if they're going to give you drugs or whatsoever, but do you really see this as a way out?
It's coming on the 8th day of the week. A little too late, but better late than never. Listen, Reuters came out with a report, I think sometime last week. The entire beds in Nigeria is 3,500.
Okay.
The entire intensive care beds in Nigeria is just 350. The entire beds in Lagos is less than 700. Now, the Commissioner for Health for Lagos, Professor Abami, had predicted that a scenario could play out that by the end of August we would have 120,000 cases in Lagos. If you have 120,000 cases, going by the global trend, you would expect that 5 or 3% will need hospitalization. So that's like between 3,000 to 6,000 people. So let's be more conservative and say 3,000, which is just 3% of the 120,000 cases. It means you're going to need 3,000 beds to take care of them in Lagos. Where do you have that? The entire country has just 3,500 beds. Lagos has less than 700 beds. Where are you going to hospitalize them? So the reality is you do not have the health infrastructure to deal with a breakout of this pandemic.
But sorry, the professor, that's the Commissioner for Health, has continually spoken on the fact that there are actually spaces, but the isolation centers are empty and people are not going there.
Exactly the point I am still making. The reason they are not going to the isolation centers is because most of those people are asymptomatic. Because more than 80% of the people who have this infection do not show symptoms. They do not fall really sick. You only have a tiny amount of people who are going to fall really sick from this infection. That's what I just told. Just between 5% of those infected are the ones who will need hospitalization. Many of people who are going to get tested and show a positive result are not going to really fall sick. So you can't be chasing people who are not sick when they can easily recuperate at home just by taking a few medications. If you have a guideline and a regulation for people to treat themselves at home and not come in contact with people and self-isolate, why are you wasting resources on those people who are taking hospital beds when the people who need hospital beds haven't yet emerged?
So what's the assurance that they would properly self-isolate and to not cause the spread of the virus?
Now that's the job of the government, because you need to ensure.
But government will not come to their houses and find out if they're self-isolated.
Oh yes, it will. Because in places like Korea, South Korea, that have been effective in dealing with this, the moment you have been flagged,
places like South Korea, not Nigeria.
I mean, do they have 3 heads?
Okay.
The moment you have been flagged that you have a potential, you have tested positive to the virus, your details are taken. There's an app that is developed. Your neighbors are, are flagged. A police, you're already on the watch list of the police. Somebody monitors your neighborhood. The moment you come out of your house, you're arrested or you're prosecuted, for violating a clear law. So you can implement these things if you want to. If you're serious about implementing them, you definitely will. So you should not waste your time trying to chase a whole lot of people, because the numbers are going up and they will continue to go up until August, because we have not even gotten to the peak of our infection rate. So the numbers will continue to go up. You can't police everybody. So you're better off giving a guideline of how people can recuperate at home and passing a law for people who break it to go out into the public to be prosecuted for doing that, and then focus your resources on the people who will need hospitalization and intensive care at the hospital, because that's where the real problem will be. And that's where, if they hit the hospitals and overwhelm our healthcare, we are going to be in serious problems. Remember that you are not just dealing with patients who have COVID-19. You have people who are on dialysis in the hospital. You have people who have heart problems. You have people with all sorts of problems in the hospital. The moment your health system is overwhelmed by people who are breaking down with COVID-19, it means it's going to be an entire catastrophe of people falling ill or people dying unnecessarily because you don't have enough hands to take care of them, or you don't have enough beds to take care of them, and then we'll be looking at a situation where we are Brazil overnight.
Okay.
You don't want to get to that point.
So let us cut this short. Now, the federal government has said they were in the stage of community transmission. Now, you're saying people should isolate at home. What about those who are in closeted environments? Will they really effectively self-isolate?
You see, we're still, I give you a typical example. When the first Chinese doctors came into Italy to help, and they showed them what the Italians call the lockdown, and they laughed at the health officers of the Italians. Is this what you call a lockdown? Let us show you what a proper lockdown is. And then the Italians had to do their jobs and enforce a more stringent efforts of lockdown. The problem is, because you have not gotten a phone call of your uncle dying from COVID-19, you have not gotten a phone call of your neighbor falling ill and dying in the hospital, and then you think it's an entire hoax. When it becomes a real problem, when you go to hospitals and doctors are turning you back because there are no beds, when you see people die because doctors cannot treat you or because they do not have enough resources, then suddenly you realize that this has become a big problem, and then government will be compelled to now enforce greater regulations to ensure that people stay at home. I believe that it can be enforced. I believe when there's a will to do it, people will do it, and all government needs to do is to ramp up its communication and engage with citizens to tell them what the dangers of these diseases, and encourage people who have these signs to stay at home. And I think you can achieve that.
All right. Tell me, Rade, do you also fall into this opinion? Do you feel that we can effectively at-home treatment for COVID?
It's correct, but not in Nigeria.
Not in Nigeria?
Not in Nigeria.
Why?
Let's be realistic. Let's use our own country as an example. This is the same country where governors are relaxing curfew. They are opening religious centers, opening markets. How possible? I mean, how can you achieve that? People don't even take lockdown serious. You see people walking around the streets. People should enforce it on the streets. Police are escorting people. They are crossing over the country. At night, they move across the federation. I mean, we can't achieve it. And because people are not showing us example, good example for that matter, people don't take them serious. And that's why a lot of people are questioning this whole issue of COVID-19. They must show example. The other day, Kano State Governor, after the president gave directive, he went the other way. And nobody questioned him. Nobody questioned him. I think the governor of Ondo State is talking about relaxing, opening the market. A whole lot of them are doing what they want. It shouldn't be. Somebody must speak and every other person must fall in line. It's not about government. It's pure politics.
So you feel
don't do things right here. And I don't blame people who don't believe in this. Because people should set the example and drag this thing down our brain and not doing it. They don't even believe this thing exists. Except maybe a few governors and all that. We can see what's happening in Kogi State. They don't care. A lot of people see, if you don't set good example, people won't believe you. And because of that mutual mistrust over time, and governments don't bothered. They're okay with the way things are going. You don't blame the citizen at the end of the day if they don't believe you. You need to show example. It's when you show example, I can then follow you. Things are not working well here. We can see what's going on. Some are saying open churches, the markets, Anambra State started it, and I was expecting the president to react to it. So when they go across businesses like this, what do you expect? It may happen in Korea, US and all that, in European countries, but here it's not happening. So you
would say that if you find out that you're positive for COVID-19, you should go to isolation centers rather than
isolations. Right now, let me even come to that. This isolation, okay, like the Commissioner for Health in Lagos, predicting by August a high figure and all that. We don't have best spaces. We know that. Between now and that time, what are we doing to get these things? Why are we not investing in research? Why is it that we are predicting other countries? That's what they are doing at this moment. How can we curtail it? How can we stem the tide? How can we bring the figure down? We don't predict. What are you going to do? What are you doing? Madagascar, they brought in some things here, and till now I don't think they're using it. What we stand to gain? What country? People have been standing up. Scientists in this country. We have cure for this. Why do we take things a joke? Can't we just be for once be reasonable and do things that other countries can copy? Look at Madagascar, for instance. That tiny country. We are jokers in this. We are jokers. And until we do things rightly, take away politics from the things we do, we will be moving and making progress in circle. We will not make. In fact, look at COVID. That people are dying. When you watch TV at times, you want to collapse when you see what's going on across the world. Go around Lagos. In fact, I'm in Lagos, so I can't say what's happening in your state or Ogun State right now. But in Lagos, go around and see people. They don't care. They don't know anything because they don't believe to an extent that this thing exists. Someone tell you it won't get to us. It's not a sickness. So that is where government needs to come in and change that narrative. Are they doing that? No, they are busy sharing palliative. How many people have not seen anything? I've never seen an unserious government as this. It's not linked to this. Nigerians have taken Nigerians for a ride for too long. This is the time where we would have expected government to have empathy on the people. This is the time to reach out, not election time. And if Nigerians think the way I do, election will come, and we have to flog some people. You don't come because we're waiting for you to come at this time. You are nowhere. You are busy.
All right, thank you very much, Tony. Of course, he has made his own point there. While Adjo is saying that it's actually be good for us to start self-isolating at home due to the fact that the health sector will be overwhelmed by the increasing number of cases.
People self-isolate at home. Even some state governors are kicking against it. Yes. It's not for work for Lagos. How can you do that? How do you monitor such? If people self-isolate, how do you do that? People came back when they were at the airport that once you come back you self-isolate. How do they track them?
All right. Okay. Thank you very much, Tony Omode. Of course, he has been quite passionate about the fact that, or rather, the failure of the federal government, and of course, the fact that self-isolation cannot necessarily work in Nigeria. Well, vis-a-vis overwhelming the health sector. Of course, you can send in your messages 0814-6588-756. Messages are already flooding in. But still on the issue of COVID-19, quickly now, Adio, we also heard news about reopening of churches and mosques, religious centers and the rest, and Nigeria has urged Nigerian government to allow churches and mosques to reopen for worship. Now, Khan said since offices and markets could be reopened, the same privilege should be accorded to religious institutions. Do you feel that it would be too soon to do that? I mean, they have said that they will follow all the guidelines. They said if markets can be opened, if offices can be opened, then churches that have better regulations, why can't they be opened quickly, Adio?
Yeah, I mean, we can debate whether or not that should happen, but where I find funny and laughable is the fact that the government have asked these religious organizations to submit a guideline
yes,
for opening. Now, that's ridiculous on many levels, and this is the problem I keep saying. The government doesn't have a plan. You are asking people that you should regulate to send you a plan for you to approve.
Or rather, you giving them a plan.
I don't understand it. I mean, I'm shocked. It's ridiculous. It's ludicrous. It's your job to put out a plan and a guideline for religious organizations to follow. You are the one who has the data. You are the one who monitors the situation every day. You are the one that knows the impact of a resurgence of this infection. And here you are asking people to send you a guideline. It's a complete joke. The government at all levels, federal, state, and local government, are the ones who need to work together to agree on a specific guideline that is backed by science to ensure that once these religious houses open, or once these schools open, it will not be responsible for another spread of infection. Because if you look at the early spread of these infections across the world, most of them happen from religious houses, from index cases that went into a church or went to into a religious gathering and spread it. So you need to be careful before you open these organizations, and you cannot leave that to the judgment of various religious leaders across the country. It has to be driven by science. It has to be driven by research backed with data to ensure that once these places open up, we can say to a high degree that it will not be responsible for another spike in infection. And if you don't do that, of course they are not doing that, so they're left in the hands of religious leaders. And you see, again I say, I think we're lucky. We make all these postulations because this infection did not really hit us in Nigeria, or it didn't really hit us in Africa. If we're in a country where you saw the numbers of death rising up, if you were in New York, for instance, and you saw people dying from memorial service to memorial service, maybe that would have triggered government officials to be on an urgency mode, to do their jobs deliberately and to do their jobs passionately. I think because of that, you can have governors like you have in Kogi State who are denying the existence of this virus. You have governors who, want to just open up their prayer grounds tomorrow, for Salah celebration. You have all of that, and that's simply because, for some reason, God lives in Africa. The infection hasn't killed us as much as it's done in other parts of the world, and so, we can play around, because the truth is, science has shown that this disease is going to be with us until the end of the year. Nigeria cannot afford a lockdown. Its economy is tanking. The price of oil has crashed. We have reviewed our budget twice. So we cannot afford it. We cannot afford to fund research centers. We cannot afford to fund the discovery of a vaccine. We cannot afford to expand healthcare infrastructure in the next 6 months. We cannot. So maybe that is why we need churches to open and pray to God to help us in this very difficult period. Maybe that's the only sentiment I see, because aside that, your government is not planning. Nothing is happening. We're just looking to the skies and saying, okay, something would happen. Maybe we'd wake up one morning, somebody announced to us that coronavirus is dead, and then we'll move on with our lives.
That's what they expect.
All right, well, okay, let's take some messages here. Now, we have here, good afternoon, school feeding program should be for all school children in Nigeria. This food should be given once in a week. That's Divine from Lagos. We also have here another message. Please, messages only. The school should be open. School owners will provide all measurements for COVID-19, just like the time of Ebola. This one is advocating that the school feeding program should commence. We also have another message here. Good day, Rita, and the two gentlemen with you here. The so-called school feeding program is a total mess and failure to Nigeria, a country that said they are fighting COVID-19 and they are jeopardizing the future leaders of this nation. That's from Pastor Francis there. We also have another message here. It said, from Enoch, watching from Calabar, school feeding is a scam because there is time for everything. Schools should remain closed because children cannot wear face masks for a long time. Government should invest in education. We are not prepared for COVID-19 because there is no blueprint on the way forward. He also said, how do you self-isolate in a room of 5 people? I need an answer. I think that question goes to you. How do you self-isolate now in a room, maybe there are 5 people there, or this boys' quarter? How do you expect them to self-isolate?
I think the problem is you're not getting the point. You have only 2 options. Is either you go to the hospital, the isolation center, or you stay at home. There are no beds in the hospital. What are you going to do? You want to stay under the bridge? Fine, stay under the bridge and isolate. You don't have an option here. That's the point I'm trying to make. You are not going to have enough hospital beds. Okay. So when you're sick, what are you going to do? Stay out on the bridge?
So you stay at home.
Well.
So you stay at home, and then
you don't have a choice here because you can't go to the hospital when this thing breaks out. There won't be enough beds. So what do you do in essence? You have no choice but to find another place to stay until you get better.
Okay, all right. Let's go to another issue here. Now, we know that during the week, the Lagos branch of the Nigerian Medical Association called off its sit-at-home order over the harassment of health workers by police officers. Now, in a press statement signed by the chairman, Dr. Salio Senu, and the secretary, the doctor said the decision to reverse the sit-at-home order was informed by the intervention of the state government and the top hierarchy of the Nigerian police. We know that the Lagos branch on Tuesday night asked its members to embark on an indefinite sit-at-home order over harassment and intimidation of medical workers by policemen. Now, this is not just only medical workers. We know that journalists and essential workers who were excluded from this curfew were also harassed due to supposed statement from the IGP saying that nobody should be excluded, and once it is 8 p.m. the curfew order from Nigerian government does not exclude essential workers. And due to a lot of criticisms, the IGP rescinded its order and said essential workers are excluded. Tony Nwaje, is there a problem of synchronization, misinformation, non-sensitization? What exactly is the issue there? Because I know from the federal government, essential workers were excluded. So what happened that made the IGP say essential workers are not excluded, and then later on when people started complaining, you now rescinded your order?
The fact is that the IGP realized his mistake, he owned up and corrected it.
But why would you say, when they've already given an order, why would you say essential workers are not excluded?
I said, did he?
He realized his mistake, yes?
I was listening to a news channel that particular night when this thing happened. He didn't take the IG for like 30, 45 minutes before I saw, then I saw a statement from Frank Mba, and apologizing. The fact that we moved on, and it was the next day, the Medical Association went on strike. And I think if not for the intervention of the Lagos State governor, I think by now we will still be on a strike. That strike, I'm not supporting the IG for that move. It's just the normal mistake you get from government every day.
That's a very common mistake.
It's in a sinner crime. Somebody should be taking a query for this. But who's going to give the IG a query, for instance? So life goes on. So we don't need to overflog it because we have jumped over that, and life goes on. That is the country we find ourselves. So let's overflog it. They moved on. Did you say I saw a very senior journalist the other day telling the IG, you must apologize. And I said, in this country, apologize to who? He will not apologize. He sees it as nothing. I corrected it, and the next day you're on the road. So, and then the governor of Lagos State intervened in the Nigerian Medical Association strike and all that. And I think the Medical Association made a mistake anyway. This is the wrong time for them to have embarked on that strike. There are other avenues to...
A wrong time when they're stopping you from doing your duties?
No.
I think it was more like a warning to the government.
Strike is not everything. Not now that we're having... We're having few medical officers. This is the issue. We are talking about COVID-19.
But Tony, you know if they didn't call for that strike, you know that the IGP may and may have not.
There was no strike that night.
There was no strike, and they already said you're going to go on strike, and that's what made him revert the order.
Strike is not everything. ASU does it all the time. I've never supported them. Strike is not the issue here.
But it's a way out.
It's a way. In this case, maybe they have.
And what if that's even the word the federal government understand? Because from what we've seen here, I think let me go over to Adio now. Over time, we know that when public sector institutions talk about strike, and then the next thing we see the federal government acting now. Do you think that?
Well, as I said before, the strike was the Inspector General of Police corrected himself that the night before the strike. I'm just saying that the medical doctors were not supposed to, at least for the sake of the issues we're talking about today. We don't even have we don't have sufficient doctors going around. A lot of them are even taken off. They are not reporting to duty.
Okay.
So, I mean, that's my position, and I maintain it.
Okay, Tony is saying they shouldn't have gone on strike when your life is at stake. And what's your own take on this? We know that we've had...
I had some people who were I'm a journalist too.
Yeah.
And there are times when you are a journalist, you don't have any business out there except on an official function.
But these people were unofficial. No, I think they've also been around.
The majority. And that because we take things on. I saw the lockdown in Ogun State, Lagos border. And a lot of people were on the other side. Because before the enforcement, these were things we faced. I've seen people write press on the body of the vehicle and all that. And to secure
but it's a simple thing. When you write press, you show your ID card, means of identification, and even after your means of identification,
there was a curfew from the federal government. At that point, you have to start seeing people. That's when which
excluded essential workers.
There was a lot of confusion, yes, and they corrected it the next day.
Let's talk about you here. Let's say, what's your own take on this?
Not an issue.
Because there are a lot of criticisms on security agencies.
Again, I'm glad that everybody on this table is a journalist and you follow global trends. So I'd like to ask a question. In which country have you seen the IG address the nation during this COVID-19? Just name one country.
None.
Again, it's not the job of the IG to give guidelines.
That is what I'm saying. That's because it's in Nigeria.
Then why did he do it at
Why did he do it?
Because there is no coordinated effort at the center.
It's not the same thing.
There needs to be a standard plan and guidelines issued from the task force. It is the highest decision-making body as pertaining this pandemic.
By the president, not the task force. The president himself.
The president has already given the task force.
Yes, the president is, by virtue,
he's the president of the country.
The task force directly leading this COVID-19. So every guideline should emanate from there. If they say that this is an essential worker, then that automatically becomes an essential worker. And you would have expected that before those guidelines are issued out, they would have coordinated with every head of security agency. They would have coordinated with every major government agency across the country before certain guidelines are rolled out. A situation where you need to get the IG on television to clarify whether doctors are essential workers or not is the reason why our country is where it is today. Because you did not need all of that charade. You did not need all of that macabre dance. The guidelines should have been clear from the beginning. Who an essential worker is.
Do they know?
It should be clear. And so we keep going back and forth. We keep majoring on the minor, and ignoring the camel in the room. So everybody's now shouting the IG. Is the IG the one generating data? If the IG makes a statement today and then the task force said no, we didn't issue that tomorrow, what happens? It's a complete joke. So somebody needs to own this thing. Somebody needs to put out a clear plan. And I keep hammering on that every time. There doesn't seem to be a clear plan. You should be thankful that the governor in Lagos is up and doing. You should be thankful that he's quick to react to a certain situation. Otherwise, it would have been an absolute chaos in Lagos State. Because it looks like you issue a statement in Lagos, the next in Abuja is saying something different. Lagos said Kano is doing something differently. So you are moving Alamajiri from one place. I've never even heard of such before. So you are moving Alamajiri from one place to the other in the time of a pandemic. You say no interstate travel. Some governors allow people to move out of their own state. And then they are pouring, just like you said, you see the traffic sometimes in that Lagos-Ibadan expressway coming into Lagos. You're wondering where are people coming from? How did they cross over several state checkpoints to get to the borders of Lagos, to rush into the state? It's because certain governors are looking the other way, whereas certain governors are trying to do their jobs. And this continues to happen because there is no coordination from the center. And we can continue to pretend that one exists. We can continue to pat it on the back, but we should be thankful that this crisis has not been as life-threatening as it has been in other parts of the world. Otherwise, we would have realized what a shamble the whole coordination has been.
And that's why they're not taking it.
Okay, what about the violation of human rights? Because even aside from essential workers, we know that there have been complaints of Nigerian citizens being violated by security agencies. Don't you think something should be done concerning that?
I mean, there's been violation of human rights for only God knows how long. You've been shouting end SARS, end SARS. Has your president issued a single statement on the killings of SARS by young people? No. We've been shouting, people have been campaigning, people have been going on the streets to demand that there should be better regulation of the excessive use or the abuse of power by security agencies in this country. Nothing has been taken up at the highest level of government. You see, in this country, the government is willing to protect a barrel of oil than it would you, the common man. We'll put more military infrastructure to protect a single barrel of oil than we would to protect the average citizen. In this country, bandits can run down several communities, maim people to death for hours, and they will tell you the road to that place is bad. That is why security agencies cannot get there on time. You can imagine the excuse people give you for the killings of hundreds of people. So that's the kind of country you live in. So, I mean, the level of rascality displayed by certain men in uniform is unbelievable. The audacity that they have to point a gun at a doctor. You forget that when you have an injury as a policeman, it's a doctor that is going to treat you. When your wife is going to give birth, it's a doctor that is going to treat you. In fact, the journalists you are harassing, when you are old, you slip stories to us to publish for you, to make noise for the government. When you are illegally dismissed, you come to us for us to run your stories. So you wonder again what kind of training you go through that makes you so desensitized towards the people you're supposed to protect. So I think there's a cultural problem in the Nigerian police and in most of our security agencies that have to be overhauled via curricula, and we need to start doing that as soon as possible. Otherwise, the police cannot be the enemy of the people. It should be like they say, our friends. But of course, we also citizens need to take personal responsibility. If you have nothing doing at past 8, whether you're a journalist or not, just like you rightfully said, what story are you going to cover at 9 o'clock in Lagos Ibadan Express?
But when you're going home,
I mean, the clip I saw on TVC, the border was shot after the journalist estate where people are coming in from Lagos. Right. So I'm wondering, where did you go to Abeokuta to cover a story or state that you are coming back at that particular time?
For me, I need stricter enforcement.
Stricter enforcement.
Let the they will know. I mean, they will have civil. They will have neighborhood safety, neighborhood watch. We have Federal Road Safety Commission. We have Nigerian police. Most times you see some of these checkpoints. We have military men. So right now, you know it's 8 o'clock. Please try and get home before 8.
Okay, let's take this message.
It's a directive from the federal government.
Okay, harassment of essential workers by security agencies is a breach of public trust by our security men. Some people disguise as essential workers to violate the executive order. Child from Enugu, that is very right. And I would kick against all those who are causing problems and disguising themselves as essential workers. Do not flout the orders, the law of the land. Unfortunately, this is how we'll draw the courses for today's edition of Editors Forum. Thank you very much, Tony Nwaji, and of course, Ayodele Lawal Adio. Thank you very much for being a part of the show, and to our beloved audience, thank you for being a part of Editors Forum, and to all those who made today's program a success, I say a big thank you. And of course, do join us same time, same station next week, God's willing, for another edition of Editors Forum. I am RITA, OMODIA. God bless Nigeria.